And we're going to go to Verizon. Gary, we're talking about specific examples you'd like to highlight.
There was a paper that I was part of, a white paper that I was part of last year, and it was called Heartbreak in the Heartland. And it was a group of us that came together, and what we did is we highlighted the problems that are facing folks in rural America. And I can share this paper with you if you'd like to read it, but really the net of it was challenges around access, right? So we talked about turning parts of rural America into, I'll just say, innovation hubs, if you will. And so one of the areas, and we've had a number of successful projects over the last year related to this, and it's taking healthcare and moving it into non-traditional healthcare settings, right? There's an announcement we made with URMC and Five Star Bank, and we're putting health kiosks in banks, so folks who are in rural America tend to frequent their banks more than folks who are in urban America. So we're going to the places where people are, right? I like to camp at this little town called Broken Bow in Oklahoma. Well, I don't go by any hospitals. I don't see, any physician practices, but I see, like Dollar Generals, and I see, different places like that. And so that's an area of focus for us in libraries, putting health kiosks or clinics and virtual clinics, if you will. Jennifer mentioned amazing work they're doing with some tribal communities. We just had an announcement where we're working with a tribal community in Ketchikan, Alaska, where not only have we put a private 5G network on their tribal communities, but we're also putting some virtual kiosks just to help with access, right? Because, let's face it, social determinant of health, an SDOH determinant for an individual access connectivity is a crucial component. If you don't have connectivity, you don't have access, right? And so the example with the virtual clinic on the tribal community land, it's really exciting because, imagine an 8x8 kind of box, if you will. Now, each one of those, they're very sophisticated. It's not like one we would put into the bank, but these are going to be manned by a nurse. By the end of the year, they're going to have CT scanning capabilities. This is a virtual ICU, if you will. So lots of focus around things like that I think surprises people when I talk about some of the things we're doing at Verizon related to helping improve access. Just trying to go, I guess, non-traditional, if you will. So lots of exciting work in that type of area.